Hey everybody, Dr. Diane Mueller here. In this video, we're going to talk about West Nile virus recovery. Now, this is an important topic because West Nile virus, it comes from mosquito bites and it can look like a lot of other disease processes. So we want to make sure that we catch it and that we're testing for it. Oftentimes people have fevers, a lot of pain. It can feel in many ways like the flu. One of the reasons why we want to make sure we catch it is it can actually get into the brain and it can cause encephalitis, which is swelling of the brain itself. It can cause meningitis, which is swelling of the covering of the brain. And these types of things, not only are they very impactful as far as their symptoms, they're very impactful as potential long-term damage that could happen. So we really want to take West Nile very seriously. So when recovery is difficult, so for some people recovery is no problem, but oftentimes if recovery is difficult, there's a few different things that could be going on. One thing that can be going on is that you might be missing some of the other things that were transmitted with a mosquito bite. So we now know that mosquitoes, there's limited studies that are showing that mosquitoes also have Lyme disease, which is a neurological disease that in its acute stages can look very similar to West Nile. So we want to consider that if you're not getting well, if you're finding yourself with a difficult time recovering from West Nile, it's quite possible that you don't only have West Nile. And a lot of recovery comes down to understanding the full picture. So there's two different ways we want to look at recovery. We want to look at getting rid of all of these infections that could be inside of you, not only West Nile, but anything else that was transmitted with a mosquito bite. But then we also want to build the system up from any damage that has happened. So you want to make sure you're running labs that are checking for liver function, for kidney function, as well as for nutrient imbalances. It's not uncommon in these chronic infection type of scenarios that we can become very depleted. We can sometimes find that our body and our adrenal glands, the glands that are responsible for stress, can take a hit. We can find that cortisol levels are lower than normal, that DHEA levels are lower than normal. So part of really getting over something like West Nile is to make sure that we understand the totality of everything that could be involved with that mosquito bite, everything that was actually transmitted, right? So running tests, my favorite test out there is from a company called Vibrant Wellness. Running tests from that company is a really wonderful thing to do. In addition to that, we also want to think about making sure that we are treating our adrenals, making sure our thyroid is healthy, making sure that we have proper nutrition, we're building ourselves back up. And we also want to remember that anytime we have infections inside of us, part of how they make us feel bad is they've released molecules that are actually toxic to our body on some level. So we want to help our body detox from these things to help lower the toxic burden on our body as well. So if you need help with any of this, information about how to work with my clinic is in the show notes. Please do subscribe to my channel if this is helpful for you, and please don't keep me a secret. Please share me with your friends and family. I'll see you next time.